I played field hockey in college, and I really always liked the atmosphere of a team and working together for this big common overall goal. And I felt like surgeons were that team. Everybody worked together. It was always about getting the patient in the operating room, having everything go well, and then afterwards they're just this new person. We fix their problem. I just really loved the creativity, the teamwork, and being able to help a patient turn around and say, that thing I came to see you about, that problem I had, it's gone now. We fixed it. When I was about 5 years old, I kind of knew I wanted to be a doctor. My abuela is from the Dominican Republic, and she just always studied science. She actually got her PhD in pharmacy in the Dominican Republic. Since I was a kid, she talked to me like an adult about the world around me and cells and biology. And so I just kind of always saw the world a little differently and knew that being a physician was the best way to help the people around me. After I got married, I wanted to take his name for our kids, but I wanted to keep Ortega because my abuela always talked about how I was going to be the first doctor in the family, and that was really important to them. Also, it's just my personality. Growing up, everyone said, Ortega, you're a little spicy, a little fiery. And it's true, I am, and I feel that way even for my patients. I love talking to the insurance companies when something doesn't get approved because I'm like, okay, hold on a second. My patient needs this. Latinos, sometimes we don't want to navigate the medical system because it's hard and there's language barriers, of course. I always treat every patient like my family anyway, but when I see a Latino patient, it reminds me of my family. And so there's definitely this extra connection. We treat patients really in all fields of general surgery, but specifically in the minimally invasive fields. Endoscopic surgery, where we go in through the mouth using the endoscope and do surgery from the inside. Patients who have issues with their lower esophagus, any stomach issues that we can fix from the inside, those are the patients we would use that for. Then we do complex hernia repairs. So any patients who have had a hernia or maybe had surgery already on that hernia once or twice in the past, and they might already have a mesh and need some help because of how complex the repair would be. We like the complexity. We want to fix those intricate problems. Foregut surgery is that lower esophagus, stomach, and the small intestine. A lot of foregut patients have issues with swallowing, or maybe right after they eat a meal they have a lot of reflux or indigestion, and so there's surgeries we can do to help them with that. And then the last category is really close to my heart, weight loss surgery or bariatric surgery. Our society doesn't realize that weight problems are genetic, and it's really a true disease. When you do surgery, you rearrange the way that the body processes hormones and the way the body handles weight. Just watching the transformation that patients go through, they come to you and they're frustrated years of dieting, who come in on 10 different medications, and they go down to 1 or 2 after the surgery and the weight just flies off, and then they're able to live these really healthy lifestyles that they've always wanted to. I came to Brown Surgical because my husband is from the Providence, Rhode Island area. I came to visit his family a couple times and just fell in love with it. It's absolutely beautiful here. There's great food, the water. When I'm not operating and I'm not working, I love to discover the awesome little areas of Rhode Island. We like to go hiking. We take our chocolate lab out swimming and find little waterways. I also have twin girls, so my husband will take one and I'll take the other, and we just rock and roll outside somewhere. It's been really fun here so far. I fell in love with the area, but most importantly, Brown Surgical Groups as a whole, the physicians in this group are just so impressive. Really, really, truly innovative, super welcoming, just good people. Not just good surgeons, but they're good people, and that's what I wanted to be a part of. People come to you with this problem that's affecting every minute of their life, and then you come together, come up with a surgical plan, execute, the surgery goes well, they do everything they're supposed to do in recovery. That's what it's about. It's awesome.